Christine, do you have thoughts?
Just to dovetail on that, I think absolutely I couldn't agree more. And I think, you know, I just came back from a bunch of qualitative research with patients in my disease category, which is osteoarthritis. And I saw this like fine thread of like, the best word I can get is like control. Like patients want the information, you know, when they're ready to get it. I know that sounds like motherhood and apple pie, it certainly does. But, you know, in how we've evolved this industry, you know, with our communication tactics, it really is kind of getting back to the core fundamentals, which is, and when we talked about other CPG industries that have cracked the code and said, you know what, we need to give people the information the way they want it, where they want it, you know, and when they're ready to hold it and receive it and action against it. Right. Instead of these large scale, you know, TV, and please, I've done it, we've all done it, you know, but it's definitely a different model. And I think with how busy this world has become and how much information is pushed at people, that's what I saw in this research. I saw a level of education I haven't seen in 20 years that I've been in the industry. And I saw a jaded kind of mentality that I'm not sure I believe the information you're pushing at me. So I think to Debrianna's point, I mean, the engagement, control, kind of getting your message to people where they are when they're ready to get it, I think that's key critical. However, I think, you know, as we get back to our management, you know, on the client side, that's going to take some shift. The gentleman from Sorona had the tipping point. He's right, but it's not going to happen overnight. Right.
So does it matter where or when you reach your target to optimize engagement, or is it equally appropriately no matter where they are, that's where you want to be? Or is it more important where and when?
I believe in the recency model, and I believe that hitting people at the right time with the right creative message at the right frequency is very important. And since that can be controlled in certain media like digital and search, you should use that as a tool in your kit. And make sure that if someone is in a healthy eating content that's for diabetics, that there's an appropriate messaging strategy there. And I think to Christine's earlier point, most pharma companies have a limited amount of creative that's approved, and they send it to the same consumer over and over, whether they're new, newly diagnosed, on script. And I think it's time to really think about each of those patients as the person that they are, which may have a different learning cycle, a different frequency model, and a different communication stream.
Yeah, you're going to have ROI. I know we love the ROI term. You'll have different levels of ROI tethered to each of those phases Debrianna spoke to. If I'm further up the chain on, you know, understanding my disease, you know, or even accepting it, it's going to take time for me to move closer to actionable, you know, behaviors, right? But someone closer in who's maybe been suffering for a while gets it, understands it, but wants to try to, you know, either not solve it, but do something more, they're going to be closer into doing something like going into the doctor and having a dialogue. And another thing on the when, if I could just speak from a commercial standpoint, because I am a P&L person, you know, medical visits have been down, and I'm sure you guys have been looking at all the data that we all take a look at in this industry. And so if people, you know, have lost their jobs or lost their insurance, or their insurance is not rich, and we all know from watching 2 minutes of news at night, insurance coverage is very, very challenging, they're not going to go to the doctor. I mean, I've seen data in some of the business planning I've been doing that even transplant drugs sales are down. People are actually hoarding their drugs and taking them, you know, less and less and less because they can't afford them. Well, they also can't afford to go to the doctor. And it, you know, for a product like mine that has a primary care, venue to it, you know, we do go into the primary care sector. That, you know, people are cutting off primary care visits. They're reporting that they go twice a year for things like, you know, I have a fever and it won't stop, or I have to get my concomitant meds refilled, but nothing more than that. So I think, you know, to Debrianna's point, it's not only just, you know, doing this type of thing because it's how the communication track is evolving, but it's knowing where your patients are and what they have to do, you know, and message them appropriately.
Absolutely. So we see even today, you know, the typical DTC model starts with TV and print, drives to an online resource, typically a brand site, with registration, with almost a prescribed pathway that the company has decided this is what we want them to do, which is essentially my TV ad, my website, my registration, my database, my asset. Is it that simple? Are we missing something here in terms of execution if that's the pathway?
Why don't you start?
I think you're shouting in the wind. I mean, you know, at the end of the day.
That was a softball, by the way.
Yeah, I think you always set me up, Tim. I think you're shouting in the wind. I mean, my. I mean, Debrianna made a comment earlier, you know, that people are, you know, out there doing, you know, looking for information or talking where they need to talk. You need to pay attention to what they're doing. I had said to Debrianna earlier that, you know, I did something that's probably heresy in our industry. I was like, I found out that they were you know, in chat rooms were talking about my products. I said, let me take a little listen over here. People were like, what? You can't see that. I just want to listen. I want to see what they're saying. And like that was very insightful. And we have a ton of, you know, patient research that we do. But what I heard in those chat rooms helped to bring my insights just a little, you know, clearer. So that was helpful. But again, I think you talk about the word engagement, and engagement could be what people are doing on their own behalf versus what, you know, I'm trying to get them to do, the me. Look at my TV ad, go to a website, you know, do this. I think that's pretty draconian at this point.
Yeah, and I think that one of the things that both advertising agencies and clients themselves need to challenge themselves with is oftentimes the media mix is determined by things like quintiles, which says, hey, you know, X% of my audience spends 12 hours watching TV a week, and they'll compare it to maybe 2 hours, you know, or so, a smaller number with another medium. And I think that is a time spent model and not an engagement model. And I think what you'll see, as Christina's pointed out from the research she did, is that an hour researching a drug, or hour researching a condition, or an hour researching and talking to fellow patients online is probably more valuable than an hour watching 60 Minutes. And those are the types of engagement quality quantifiers that should be used to determine what I should be doing in terms of my media mix model. And most clients are still kind of married to the big DTC broadcast TV focus continuum. And you know, there are some people who've opted out from TV or only use DVRs and are not seeing ads. And there's definitely the same ability to get awareness information through another medium while still getting, you know, you can click away, you can research, you can bookmark, you can forward to a friend. These are types of things that doesn't really work so easily in a print ad, an outdoor ad, a television ad, or radio spot. So I just challenge people to think about how engagement and the media mix model can really help the brand, especially when the days of the blockbusters are somewhat limited.
Right. So we finally have, you know, some of our upper management talking the language, and it just sort of reminds me of about 10 years ago with the explosion of the internet, right? You got a knock on your door, and your boss came in and said, we need to be doing the internet. Why aren't we doing the internet? And then it was a big race, right? I need internet. I need to check the box. I need to have internet going. And what happened was big race to get in the space. People bought the .coms and keywords and built some websites. And what happened? Under-delivered significantly. So big hype, poor delivery, and we've kind of, you know, tried to rebuild from there. Do we run the same risk right now with the emergence of the social media space, where you now have bosses come in and ask you, what's our social media strategy? And you've got to have an answer. Right. And you may have to actually execute something. And do we run the same risk right now of overhype, under-delivery that we'll have to recover from if we don't think thoroughly? First of all, do we do it, and how do we do it properly?
I think we do run that risk, and I think what people need to remember is when someone says, we need a social media strategy, your first question should be, why? And have some research and data to support it. So it may be, we just need to educate our customers, and those could be physicians, they could be patients. We need to educate our customers about how to take the drug, or we need to educate our customers the differentiation between, you know, different therapies. You need to understand the why before you jump in. And you know, I've seen a lot of people say, hey, I'm going to be on Twitter, but you know, if you have nothing to say and you have no personality and no voice, it may not be the right medium for you. You might not need a Facebook page. However, you know, there are opportunities within social to meet business outcomes, but you need to do the research to find out what they are and stop trying to be all things to all people.